And this is actually a depiction of drug use in the Egyptian pyramid, so even earlier. And actually, when mummies have been analyzed for chemical traces, there are reports of traces of cocaine, hashish, and even nicotine in mummies. So clearly not a modern American problem. Of course, we will be talking here in class about drug use here in the 21st century United States. And one of the first questions that we usually want to answer is how many of us are using them? And the answer to this is pretty complicated. It turns out that it's not very easy to get good, solid information on how many people use drugs. If they are using drugs, which ones are they, which ones, and how much. Especially when those drugs are illicit, people tend to be unwilling to talk about behaviors that are considered against the law. And even drugs that are considered legal, such as alcohol and tobacco, because there may be social stigma against their use, people do not necessarily tend to be honest when they report when and how often and how much they're using drugs. So we do, of course, need to collect some information somehow so we know where we're starting from. And we do use a couple of different survey questionnaires to get information on drug use here in the United States. Some of the benefits from surveys are that they're very easy to conduct. You know, we send them out, we get them back. They're not typically very time consuming for the people who are filling them out, and we tend to be able to reach a broad group of users. But we do have some limitations. We tend to be very interested in drug use among young people. We tend to administer those surveys in schools. So basically, if we've got people who've dropped out of school, it's very difficult to reach them through these school-based surveys. And of course, students who drop out may be at risk for higher levels of drug use than students who remain in school. And then we've also got the potential for people to self-report behavior that's a little different than they actually engage in real life. So we do have, especially when we do surveys among teenagers, we see two different trends. We see students who decide to sound a little bit more of course, we do have questions about what drug use does look like here in the 21st century United States. So we try to conduct surveys and collect data on who's using what and when and how much. It turns out, though, that this is a pretty difficult question to answer. It's not easy to find out how many people are using, and it can be especially difficult when we're talking about illegal drugs. And even when we're talking about legal drugs, where there may be social stigma against consumption, such as tobacco or excessive alcohol use, people tend not to be entirely honest with us when we ask our questions about their habits. We do send out those surveys pretty regularly, though. They're awfully easy to use, and they tend to be pretty inexpensive and easy to reach a broad population with. We do see some drawbacks, though, when we try to use surveys. Is particularly among younger populations. So first of all, if we're trying to reach student populations, we tend to do those surveys in a school setting. Now, when we do that, we're automatically missing any students who may have dropped out. And those, of course, tend to be young people who are at higher rates or higher risk for high rates of drug use than students who have remained in school. And then we also have the problem of inaccurate self-reports. People tend to lie when we ask them about their drug use patterns, and we can't even predict which way they do lie. Some people exaggerate and some people minimize. And it can depend a lot on the setting in which the survey is conducted and who they expect are going to be able to see the results. So we conduct these surveys pretty regularly because of their ease of use and their inexpensive nature, but we don't always know how accurate the data we're getting will actually be. So when we talk about who uses drugs, we're talking about really, really broad categories of people. It's a wide range of rates and amounts. And even within a particular substance using population, we may see really, really broad ranges of patterns of usage, regardless of what kind of drug that we're talking about. Of course, when we're trying to talk about prevention efforts or treatment efforts, the range of people that we may be addressing has a very important role. We do know that the more accurately our prevention and treatment efforts are focused on a target population, the more likely we are to be successful. So if we're trying to categorize a range of users for a prevention program, the fact that we're talking about many, many different kinds and ages of people can be very complicated. And also, when we talk about efforts to enforce drug laws and to treat drug dependence, this can be complicated as well. Now, we do continue to try and collect this information. One of our most important surveys is the Monitoring the Future project. Some of you may actually have taken this survey in high school. It's conducted in 8th through 12th grade classrooms and in college, and we've been collecting this data every year for almost 40 years. And what we're basically looking for here is prevalence, how many people are using, and then also perceived risk and availability. So you've got some data here from Monitoring the Future to take a look at. And what we're going to see is that it starts to show some trends over time. So if we take a look at this slide, what we're looking at here is the perceived availability of marijuana on that top blue line. And if we look at the data from 1976 till 2016, we don't really see much change in the perceived availability of marijuana. What we do see are some pretty broad swings in perceptions of risk and the number of users. So if we look at that time period between 1990 and 1992, we see at this point that the perceived risk of marijuana use has risen pretty steeply, and that the actual reported rate of use has dropped in a corresponding fashion. And then as we move into the 21st century, we see those lines kind of returning and merging together to the point where the perceived risk of marijuana use is at its lowest point since 1978, when use was much more widespread. We can see an interesting effect about 2012 of the new set of recreational and medical use of marijuana starting to become more prevalent. So we can see, interestingly, the perceived risk continues to decrease from 2012 through 2016. So just some interesting data we can get here by looking at use trends over time about drug use here in the United States. Another major drug study conducted here in the United States is the National Survey on Drug Use and Health, or the NSDUH. So this isn't just based on students. It's actually it's data that's gathered from households all over the United States, and it's done in face-to-face interviews. So there's some level of complication here. We may find that people tend to be more honest about illicit behaviors, whether they're sexual or drug-related, in an anonymous setting. So if we have somebody sitting face-to-face with you and asking about your drug use, you may be less honest than you would be if you consider that setting more anonymous. We do start with folks aged 12 and above, so we don't really collect data on anybody much younger than that. And again, this one's been collected annually for almost the same period of time. For the NSDUH, what we're asking about is, again, the prevalence of drug use, but also the frequency. And again, because it's been collected for such a long time, we're able to look at trends over time. So here's some data from the NSDUH, and we're looking at percentage of users who reported marijuana use in the previous month. We can actually see how those lines are relatively parallel, even though we're talking about two different age groups and two different rates of prevalence. The patterns are pretty similar. And if we went back to the Monitoring the Future study over the same period of time, we're going to see a really similar pattern there as well. Let's take a look at another set of data from the NSDUH. And this is actually comparing alcohol use, marijuana, and cocaine use. So alcohol in that latest purple, we can see it's definitely the most broadly used drug among the young adults responding to the survey, so ages 18 to 25. And it never really dips much below about 55% in about 2000, about 55% of the respondents reporting alcohol use in the last 30 days. We see that trend with marijuana use that we saw in the previous study, that spike in the late 70s, and then the decline, and then rising back up again more towards the 2012 data at the end. And then that bright pink there, that would be cocaine use, and we see that peak in the 80s, and then a drop off to a fairly low rate that continues through the 2012 data at the end. So it's reassuring for us as researchers to see those rates are similar. If we look at the data from the two surveys and we put them together and we see that the data reported is similar, it gives us more confidence in the fact that we're getting accurate information from both surveys. So when we combine the data from the two and see those similar patterns, we're seeing an indication that what we're getting is real data, that these trends are real, and that they're reflecting actually changes in American society over that time period. Think about the 70s, you may have some perceptions of drug use there. Think about the 80s, you may have some different perceptions, possibly involving less marijuana and more cocaine. And then into the 21st century here, where we're seeing legalized not just medical use, but actually recreational use of marijuana here in the United States. And you can see how those are actually supported by the data.